The Northwest is leading the way in training surgeons in new techniques which cut the time patients spend in hospital. The Wolfson Centre, based at Manchester Royal Infirmary, has been given money by the government to develop a virtual reality computer program. It'll be used to train doctors in so-called keyhole operations. Deborah Parker now reports on a revolution in surgery.
Minimally invasive therapy, or keyhole surgery, involves making small incisions and feeding minute instruments, including a camera, into the patient. Pictures from the camera guide the surgeon through the operation.
What we're doing is we're looking up now towards the liver.
The advantage of keyhole surgery is that patients recover quickly and there's less scarring. But it's a complicated technique and things can go wrong. Susan Edwards' bile duct was accidentally cut when she underwent keyhole surgery to remove her gallbladder.
Since then, I've been into hospital 3 times for operations to correct the original corrective practice. It left me feeling very ill, very sick, in pain. At one point I was sunshine yellow. The effect on my family has been very traumatic. It's only now that I'm starting to feel a little better, and even now there is no guarantees I will not go through all this again in the future.
Inadequate training has been blamed for mistakes. British surgeons aren't allowed to practice MIT techniques on animals and have to use alternatives like grapes. Now experts from the Wolfson Centre for MIT, based at Manchester Royal Infirmary, have teamed up with a Salford robotics firm to develop a more realistic training aid using virtual reality computer images.
We'll be able to provide for the surgeon what the flight simulator has done for an airline pilot. We will have the possibility now to reproduce very realistic looking tissues, to be able to operate on them time and time again and make mistakes without it happening on a patient. And we can learn from those mistakes and go back and practice and run it many hundreds of times.
Experts from the robotics firm have observed keyhole surgery at the infirmary to see if it can be replicated on computer.
Being able to generate touch fed not to a glove, as we've tried before, but to the instruments the surgeons use, I think the technology is literally just around the corner. Currently it's not very real at all, but working closely with the Manchester Royal Infirmary, we will listen to what the surgeons want. We're not trying to sell them products. We will take their comments and their criticisms and we will put together something they're happy with and make it real that way.
The first simulator is expected to be ready within months, and a more sophisticated, transportable version will be developed within 5 years. The research team believe the programme could eventually be fed down telephone lines into computers in district hospitals to train doctors. Deborah Parker, Northwest Tonight.